Welcome to Sports Doctor. Sports Doctor is a live presentation, so we encourage you to call into the show and ask your questions on injury, rehab, training, or technique. We'll be taking your calls shortly. Call 767-8884 for your direct line to Sports Doctor. Here's your host for tonight's program, medical reporter Joe Chapana.
Good evening and welcome to Sports Doctor. Harry Hurley sitting in for Joe. He'll be back 2 weeks from tonight when the topic will be pain management. That'll be with, of course, Dave and Dr. Alan Carr. Pain management 2 weeks from tonight. Sports Doctor brought to you by Cross Keys Physical Therapy Sports Medicine Center. Locations in Sicklerville, Woodbury, Washington Township, and coming this November 10th, just a few days from now, to Pennsville. It's my pleasure to welcome our distinguished panel tonight. First, Dr. Anthony Valarie, General Orthopedic Surgeon for Tri-County Orthopedics, offices in Washington Township and Woodbury. Pleasure to welcome you, sir. Mm-hmm. And David Anselmo, of course, physical therapist and owner of Cross Keys Physical Therapy Sports Medicine Center. Dave, first question to you. Tell our viewers, give us a brief anatomy of the knee joint.
Sure. First of all, this is the right knee. I'll go through the bones first. This is the femur, right here. This is the tibia, right here. This is the fibula. Let's go through some of that. Inferior patella tendon, superior patella tendon, and underneath here is the famous patella, right here, which is better known as the kneecap. All right. This is the lateral collateral ligament. You turn yourself around this way. This is the medial collateral ligament. Now let's go inside the knee, where it gets quite interesting. You want to hold that for me? There you go, if you would. Yeah. This is the lateral meniscus, the medial meniscus, the anterior cruciate ligament. Yeah, anterior cruciate ligament right here. Once again, the lateral meniscus, the medial meniscus, and the anterior cruciate ligament. If I turn it around, you'll see the posterior cruciate ligament right here. And that's the basic anatomy of the knee.
We'll be talking tonight lower extremity sports injuries with our doctor and with Dave, and taking your calls toll free, 888-634-7488, locally 856-767-8884 for Sports Doctor. Doctor, we read, we hear constantly about athletes tearing their anterior cruciate ligament. Tell us what that means. Why is it such an important ligament?
Well, pretty much every ligament in the knee is important. There's 4 major ligaments. They all stabilize the knee in certain ways. The anterior cruciate ligament, if you can think of the guys, Randall Cunningham, Jerry Rice, these guys blew it out in football. They all had them reconstructed, and they all went back to playing football again. So, I mean, it can be treated. Now, the anterior cruciate ligament is the one ligament, and it's right here. I don't know if you can zoom right in there. That's the anterior cruciate ligament. It's right in the center of your knee. Now, when you get a chop block in football, or you might twist and fall on it, that's when you're probably most prone to having it torn. And it's important to have that ligament intact because it helps to stabilize the knee joint itself. If you play tennis, field hockey, any running sport where you're cutting and pivoting, you want to make sure that the femur and the tibia all are nice and tight together. If the ligament is torn, you're going to have more shifting of the tibia, and that's going to lead to not only pain, swelling, the knee giving out, but if it's not treated and you remain physically active, in time you're going to have premature arthritis coming out in the knee.
Thank you, Doctor. Dave, you see so many athletes from Kansas City Chiefs stars that I know have gone to Cross Keys Physical Therapy, to the junior high school athlete, all realms. What activities or sports do you mostly see this type of injury in?
Well, I think it's like the doctor nicely explained, is any activity in which the foot is in a planted position and cutting activities occur. We see a lot of it in basketball, and probably mostly in football. You see it in soccer now because soccer has become very popular. I think it's maybe becoming more popular than football in today's times. You see it in field hockey and it's in tennis. So it's really, once again, when the foot is in the planted position and cutting activities start to occur. And as the doctor said, if you don't have really good support around that knee joint and you have a lot of play, that's when you're going to start to have some problems.
Let's open up what are always busy phone lines here at Sports Doctor. John is in Philadelphia. John, welcome to the program. Your question. John, go ahead. You're on.
How you doing?
Hi, John. Well, thanks.
I work in construction. I don't do any sports, but I'm on my knees a lot, and I do a lot of walking and physical work, and I have knee pains in my knee, and every now and then when I'm walking, like my knee will pop out a joint and I'll have to pop it back in. Is this something to be concerned about?
Okay, John, doctor?
Well, I think if it's painful, definitely that's something to be concerned about. One thing, you said you do a lot of work on the knees. Now, I don't know if you ever injured your knee, but when you say your knee pops in and out, I bet most likely the problem you're having is that your kneecap is probably popping in and out, because to actually have your knee, the femur and the tibia, start to shift and pop out of joint, you're talking about a horribly unstable knee. You're talking, the only way you can get that is major, major trauma. That hasn't occurred, then most likely it's the sensation that it's unstable. And that could be anything from, well, maybe it's an old injury that you had playing high school football or even a pickup game of football. Or it might just be that, well, maybe you're doing too much and the muscles aren't quite up to the task of keeping up with what you're putting your foot or putting your leg through.
John, thanks so much for the call. Did you want to add something, Dave?
That's very true. We see it quite a bit. It could be just as simple, especially for somebody like himself who's on his knees a lot during the day. He probably leans to one side more than the other. He could have just a basic muscle imbalance around the knee joint where the lateral structures of the knee are stronger than the medial structures, which is like the doctor was explaining. And the knee, the patella, could be popping laterally and hitting this condyle. If you can see from a lateral standpoint, this lateral condyle stands out a lot more, protrudes more than the medial one, and could cause that little bit of a sensation of popping, but you're really not. It looks like you're just hearing that audible. So it might be something you just need to take a look at.
Very good point. Thanks again for the call, John. Tom is next up, again in Philadelphia. Tom, welcome to Sports Doctor. Your question. Good evening.
Good evening. I've had a very dull pain in my left knee for about 6 months now. It doesn't seem to be getting any really that much worse, and it's not getting much better. It seems to act up when I'm stuck in like a long car ride or sitting down for a long period of time where I can't stretch out. I do run a lot. I don't know if that has anything to do with it.
All right, Tom. Doctor first.
Well, it's kind of I don't know if that's enough information to really go by to make any kind of judgment as to what might be going on. I mean, vague dull knee pain I give you a list of 10,000 things it could be in the knee. You're a runner. I'll tell you this. I don't know how much of an avid runner you are. Running's bad for the joints. Your hip, your knee, your ankle. It's bad. Every time you pound the pavement, you're causing some little micro trauma to the cartilage there. I don't know what Dave thinks, but the three best things I think in terms of conditioning, cardiovascular, as well as muscle endurance exercises are swimming is number one for me. Number two would probably be NordiTrack, and number three would probably be biking. And you could probably switch 2 and 3 around because they're all low impact on the knees or the joints in general, most likely the knee, and you can still get a workout from it. Your pain, it might be, you said the long car rides and stuff, it might just be that you might be irritating the cartilage in the knee.
Do you want to address that, Dave?
I totally agree. I think he's right on with that. I really love the water. I mean, honestly, especially when you get ready to do a lot of cardiovascular. I don't think there's a much better way. And if you see now in technology, you see these athletes, that's the first thing they do. They put them in the water, and you can't get a better cardiovascular workout than in the water. If you ever tried it before, it is truly, I think, the best way of working your cardiovascular. You have no stress on the joint whatsoever, and it's just totally an excellent cardiovascular workout.
Our next caller is another Tom from Norwood, Pennsylvania. Tom, welcome to Sports Doctor. You're on the air.
Hi, I have a question. I recently discovered I'm having a pain in my right shoulder, like right at the joint. It feels like it's like a really bad bruise, and I haven't done anything. I mean, I used to play football and I did wrestling, and then I was in the Marine Corps, and I got it about 3 years ago. But I mean, last weekend I decided to throw a football with some 18-year-old kids, and I'm in my 30s now. And I went to throw it, and when I did, I mean, my whole right arm went numb on me, and I haven't had that kind of pain like ever. Could you tell me like what it could be, like a pinched nerve or anything like that?
Tom, thanks for the call. We're going to show you how flexible this great panel is. Of course, that's a lower extremity injury for tonight, Doctor.
Well, we don't have the shoulder model of this thing. But first thing I'm thinking is, you can't be a weekend warrior anymore, and none of us are getting any younger. You're 30 years old. You're not old, but the thing is, you said you started throwing a pigskin around, and that's just. First of all, throwing a football is pretty. If your rotator cuff muscles and tendons are not up to the task of throwing a football, you're going to have shoulder pain. And if you just keep throwing it, hey, get ready for the pain months after that, because you're going to cause irritation around the tendon, the bursa. And I know you said you weren't even doing anything and you were having some pain there. I mean, maybe it's just some old injury that's now creeping up on you and it's starting to cause some pain. I mean, just not to make a dog and pony show out of it, you could try something simple, just like some exercises. And who better than Dave to give you the exercises to do. So,
thanks so much, Tom, for the call. And I do want to remind everyone that free evaluations are available at Cross Keys Physical Therapy, and we'll share more with you at the end of the program, the numbers that you can call at the various offices. Jim is next up in Philadelphia. Jim, welcome to the Sports Doctor. Good evening.
Good evening.
Hi, Jim.
How you doing?
Good.
Hey, listen, I've been having a problem with my knee. I've been meaning to visit a doctor. It's been bothering me for quite a while. I do play a lot of basketball, and the problem that I have is after playing or running on the left knee, I get a pain that's very sore to the touch. That's right below my kneecap, almost on the edge of the kneecap. And I was wondering if you guys could talk to me a little bit about that. Maybe if you run into that problem previously.
Jim, thanks. Doctor?
Yeah, it's actually pretty common. It's sort of a variation of patellar tendonitis, and it's on either end of where it either inserts into the kneecap or where the tendon inserts into the tibia. And if the pain if you could pinpoint the pain in one specific area, you might even have, if it's been going on long enough, you might even have a tiny tear in the tendon. I mean, I wouldn't expect I don't think you're going to blow it out or anything, but sometimes you do get those minor tears, scar tissue builds up around it, and it just kind of propagates the pain, especially with basketball. You're running, you're jumping, you're doing layups and stuff. That's a lot of pressure on a kneecap.
Dave, anything?
No, I think he's right on. You see that quite a bit, and I think that, as the doctor was saying, it's something that you probably should take a look at.
Anthony is next up in Deptford. Anthony, welcome to Sports Doctor. Good evening. Anthony, are you there?
Yeah, I'm here.
Good. Go. Your question.
Yeah. I have a 13-year-old son, and he's entering the basketball for the township, for our township. And I have a question about his stamina. What can I do to increase his stamina and also increase his leg strength?
Okay. Leg strength and stamina of Anthony's 13-year-old.
I think Dave would probably be good to answer this. I just wanted to say thanks for calling, because I didn't think we were getting in New Jersey here. We're getting all these Philadelphia calls.
Yeah. Well, first of all, you really don't want to start working on the stamina when the season starts. You really want to do that preseason. So the first thing you really want to get involved in is a preseason conditioning program, which consists of some cardiovascular exercises. If it's if it's basketball, you want to do some training specifically for that sport, which you'll do a lot of lower extremity strengthening stuff. You'll do, side to side motion. You'll do a lot of different stuff like that. But you want to do things pre-season. You don't want to wait when the season starts before you get into it. So that's the first and probably the most important thing I could tell you about doing that. And just cardiovascular exercises you could do. There's a lot of cross training. You do the bike. You do the EFX. You could do, of course, we were talking about earlier, doing the water. It doesn't get much better than going in the water for cardiovascular. You'll be surprised at how much quicker you will up your cardiovascular amount by going in the water at a less period of time. So, and have no stress on your joints. So I'd highly recommend you getting involved in something like that. And if you like, come into the free evaluation, and I can put together a little program for you as I see your boy, and we'll set something up.
Anthony, great advice from the expert. Thanks for calling the Sports Doctor.
One thing, too, a lot of high schools around, they have athletic trainers, at every team. Every high school usually has them. Sometimes you can even tap into them, and they can at least make sure that he's staying with the program, and he's not just sort of, Dave might set something up, but it still has to be continued on. whether it's at home or whether it's a practice or after school or whatever.
Answering Dr. Valarie's call for more New Jersey callers is Tim from Burlington. Tim, welcome to Sports Doctor. Good evening.
Thank you. Good
You're
evening.
welcome. Your question,
you.
sure.
I'm a weightlifter. I was about 2 months ago. I was bench pressing about 285 when I began to feel some left shoulder weakness with no pain associated with it. I went to the orthopedic and they could find nothing wrong, but my bench press went from 285 to all the way to about 235, and I have no idea what it is.
Okay, doctor.
I have no idea what it is. I don't know if I can. I don't know if I can think of an answer. It's not painful. All I can think of is maybe you were. I don't know if that was you were doing that reps or that was your maximum weight or what. But I'm wondering. My first thought is maybe you're just benching too much. You irritated the muscles. They kind of shut down for a while, and they're just not responding to that weight anymore. And it should come back with just some rest, and then you kind of build up the endurance again. The whole thing that kind of blows a hole in that theory is there's no pain. So I think you'd almost have to do a really detailed exam to focus the muscle groups there and maybe find out which one isn't quite pulling its load.
Off camera, Dave's been shaking his head in agreement.
I totally agree. You see that sometimes before. The body will just shut down as a protective mechanism of the body. It will just not allow you to do something that you can injure it. But most of the time you see pain. But there are occasions where you won't feel pain, and it's one of the amazing things of the body. It just has a way of shutting you down and preventing injury from occurring. So you're lucky in that sense, and like the doctor said, it probably will come back. But you might want to come back slowly.
I wouldn't force it because I see people that come in, they've ruptured their pecs.
Yep.
And game over then. You just got to wait for it to heal up.
Our gold rush of New Jersey callers continues. Jay, you're up next in Washington Township. Good evening and welcome to Sports Doctor, Jay.
Hi, how you doing?
Good,
Hi,
Jay.
Dr. Valarie. How are you?
How you doing?
Dr. Valarie, when I lie down at night, I've been having problems. It feels like I have been having pain with my left hip. Normally when I lay down, I've been having pain when I'm trying to lift my leg off the bed. Also, when I'm walking, if I turn in certain positions, if I turn to the right, to the left, I get groin pain. Or if I'm mowing the lawn, even for long periods of time, I've been noticing a progression of just fatigue in my left hip.
How old are you?
I'm 41. Okay. I have a history of working with weights, lower extremity weights, squats and things of that nature. And just until recently, I was doing lunges, and I have stopped that. I just basically work right now on a stationary bike. And it seems like when I do that, it does help me out. But it's when I'm not working out or if I'm laying down for periods of time or inactivity, it seems like I'm much more prone to having these pains than when I'm more active.
All right, Jay.
I guess the first thing is, well, I'm not a big fan of lunges. I don't know what Dave is or not. I don't really think they're very good for the joints. They put a lot of lever stresses on the muscles. But that might be, well, actually, that might be why you're causing you some of the pain. Whenever somebody starts complaining of hip pain, when you said that, I was like, "There, fine, where is it?" And then you said it's in the groin. Well, when you start complaining of groin pain, then I start thinking hip joint. So if you haven't had an x-ray of the hip, it's probably a good idea to get one just to make sure there's nothing going on there. But if the hip is normal, there's also other things. You have tendons that run in front of the hip that are right in the groin area. Your rectus, your psoas muscles, they could also be overstressed from the workout you're doing, and you could be having also a bursitis in that area. That could be one reason for the groin pain. But you should definitely get an x-ray of it.
Dave, before we go to break, your thoughts.
My first thought when he was saying this the whole time is, my question to him is, does he stretch? Are you doing a good flexibility program before you're doing your activities? You sound like you're very active. But I must tell you, the most important thing you can do before you do any type of activity is get involved in a very good flexibility program. Flexibility is probably one of the most important things you could do before you even get into that. exercise. It sounds like you're doing a lot of hip flexion stuff. So I'd be concerned to looking at that, your hip flexors and seeing if they're not tight, which could also compress on some of the nerves to go down into the hip and into the groin. So it might be a good person to come in for one of the free evaluations. I'd be glad to take a look at you.
Good advice, good call, Jay. We're going to take a brief Sports Doctor timeout. When we come back, it'll be Paul in Philadelphia. And we remind you, Sports Doctor brought to you by Cross Keys Physical Therapy Sports Medicine Center, where you can get a free evaluation at their various locations. We'll share with you all the numbers at the bottom of the hour at the end of the program. Sports Doctor continues right after this.
Sports Doctor will be right back.
Hi, I'm Kevin Ross from the Kansas City Chiefs. When I need physical therapy, I chose Cross Keys Physical Therapy, one of the leading rehab centers in South Jersey.
Cross Keys Physical Therapy offers aquatic therapy programs in a heated pool that will help you strengthen weak muscles and improve your flexibility. Our highly skilled physical and occupational therapists are experienced with working with athletes and non-athletes alike. So if you need to get back to work or back to play,
Cross Keys Physical Therapy.
Sicklerville, Washington Township, and Woodbury.
We're back with Sports Doctor, our distinguished panel tonight, Dr. Anthony Valarie, General Orthopedic Surgeon, Tri-County Orthopedics, offices in Washington Township and Woodbury, and of course, Cross Keys Physical Therapy Specialist and owner, David Anselmo. Let's go to Paul in Philadelphia. Welcome to Sports Doctor, Paul.
Hi, guys. Got a question. I had a complete ACL tear about 6 years ago. It was surgically repaired, and everything seemed to be fine. I resumed all my recreation and everything, but lately it seems there's, I don't know, a little bit of a numbness or pressure on the knee, and it feels a little bit weak or unstable. Is there risks of, it kind of degenerating, or I know you mentioned arthritis earlier. What can I do to kind of maintain or keep it healthy?
Okay, Paul. Thanks, Doctor.
Well, I'm assuming you had the appropriate time of rehab and recovery after the surgery to help strengthen the muscles up in the legs. If everything went fine, you had the checkups with your doctor, he stressed the knee, and I'm assuming the ACL graft is still intact. Now, the idea of the arthritis is if it's torn and you don't get it fixed, then you get the accelerated arthritis. I mean, that's the whole reason for that's almost the whole reason for reconstructing it. The other is for just stability and pain. You might want to go back to pull out those exercises from the file. I'm sure you have them close by, and you can just start going through some of those exercises again. It can't hurt. It's human nature. You think you kind of, okay, I've done it, I don't have to do it anymore, and you just kind of put it away. But you don't realize it, but maybe slowly your leg has just gotten a little bit weaker. The numbness and all that, I mean, maybe it's just you're having a little bit of swelling. Some of the numbness might just be from the surgery itself, but yeah, I don't think that's it from what you're describing.
Dave, what's your prescription for Paul?
Like the doctor said, it was very good. I think that you see that a lot where a lot of these patients, after they get out of the rehab center, they don't do an exercise again. And I think, unfortunately, it's disastrous for some people. Some people, they can get away with it, but because they're very active on their job and they keep their muscles pretty flexibility and their strength that way. But most of the people really need to continue to maintain some type of exercise program to maintain their flexibility and their strength. And it takes the stress off the joint if you maintain the strength around the knee joint especially. You need to really work on those quads and hamstrings, not only to keep your flexibility, but also to maintain the strength to give you that separation and to take the pressure off the ligaments and tendons in the joint.
Go ahead, Doctor.
I was going to say one last thing. I don't, you had mentioned, like, could the graft degenerate or kind of, I don't know, I guess, wear away. And I don't think that's the case. That doesn't happen with grafts.
It's a pleasure to welcome Jen in Philadelphia to Sports Doctor. Jen, good evening. Hi, Jen, your question.
Hi.
Go ahead, Jen.
In January of this year, I was diagnosed with a cyst, 2 to 3 centimeters in my left knee. I didn't do anything about it. I'm getting ready to go have another MRI done very soon. And I was wondering, do you see these a lot, and what are usually the options with those?
Well, the cyst, I'm assuming you're talking about a popliteal or a Baker's cyst. And generally that's a cyst, if we go back to the knee model, that's a cyst that occurs in the back of the knee. I mean, that is, when somebody talks about a cyst, that's automatically where I start to think that's where it is. I mean, you didn't tell me where it was, but that is basically, you have fluid that develops in the joint, and it basically needs an outlet. And the weakest part of the joint capsule is in the back, so it just sort of balloons out the back. But the problem is not the cyst. I mean, that's just fluid, and it's no big deal. You have to start asking yourself, okay, what's causing the fluid to collect in the knee? Is it arthritis? Is there a tear? Now, you said you had an MRI done before, and you're going to get another one. I assume the first MRI didn't really show anything but the cyst. So when you're faced with an MRI that's normal like that, and then all you have is a cyst, then I start thinking, okay, maybe there's a little bit of wear and tear. Maybe there's a cartilage problem in the knee that might not be showing up. On the MRI. Options are simple, either anti-inflammatories, you could try a cortisone injection, Hyalgin or Synvisc injections, and if worse comes to worse and just nothing ever takes it away, I mean, surgery would be the last option.
This is Sports Doctor. We'll use a sports metaphor. We're inside our 2-minute drill team. It's amazing. 30 minutes is not enough for your show, Dave. Just one night here, and I've come to that conclusion. I agree. 1 hour is certainly warranted. John is next up, our last caller probably, in Vineland. Welcome, John, to Sports Doctor. Good evening. John, can you hear us?
Yes, my question is 2 parts.
Okay.
Number one, I play a lot of golf.
Oh my gosh, I know who this is.
He's right. And some days my back hurts me, and some days it don't.
This was a great football coach too. Go ahead, John.
And second part of that question: can you get addicted to Advil?
Great questions. Doctor?
I guess my first thought when you said is, you know, my back gives out sometimes too, and there's nothing I can do about it. But the golfing's fine. You can't get addicted to Advil. It's an anti-inflammatory. It has, you can't get immune to it. When people say, I take it and it worked, but then it doesn't, I must be getting, I don't know, immune to it or something. It's just not true. It's just that the problem you have is getting beyond what the Advil can actually handle. So
he was the longtime head football coach at Vineland High School. That's a legend that called your program tonight, guys. Dave, your final thought, about 30 seconds.
My final thought to him would basically be, just like anything else, I'd recommend, even with golfers, I do pre-seasoning for golfers. I think strengthen your abdominals, strengthen your back extensors is very important for golfers, and maintain your flexibility. The
numbers are up on the screen. We're literally out of time. I know the doctor.
Make sure you take a cart. Don't walk.
And John, it's great to hear from you on the Sports Doctor. All the numbers are up on the screen, including the brand new Pennsville office that's going to open up this November 10th. On behalf of everyone, Dave, Cross Key Physical Therapy, our doctor, have a great night.